Heart disease is the leading cause of death for men and women in the U.S., but the good news, it's also one of the most preventable. Dr. Nicholson is a bariatric surgeon and founder of the Nicholson Clinic, and he joins us this morning with the implications of weight on your heart and how bariatric surgery can help. Good morning. Nice to see you this morning.
You too.
Good. So one of the most common risk factors for heart disease, as we said, is being overweight. You say being overweight makes you more likely to develop heart disease and stroke, even if you don't have the other risk factors.
Accurate. When you think about it, we say heart disease, and in medical terminology, that's actually cardiovascular disease. So there's the cardiac component of it as well as the vascular component of it. When your heart's working harder, it actually injures the arterial system.
I didn't know that.
And that can actually lead to formation of plaques, which is what leads to strokes, or in diabetic cases, amputations or pain and inability to walk.
Very, very serious complications, potentially. So we know that bariatric surgery can help. How can it improve heart health specifically?
Okay, so actually there was a really interesting study that was presented at one of our national meetings just a few months ago that showed that after bariatric surgery, your heart can actually revert to normal size and function.
Really?
Yeah.
So it reverses the damage in a sense?
Well,
or go back to its original state?
Certainly. At a certain point where it's not reversible, you can't. But to the extent that it is, it will. And if you think about it, the heart is a muscle, right? So if a regular scenario, we were talking earlier, if you're lifting weights, right?
Right.
Okay, so bigger is better in that case.
Right.
Okay, not in the heart's case, because it actually occupies more of the space that the heart can utilize to fill up with blood, so the heart paradoxically becomes less effective.
That makes sense.
And the Cleveland Clinic has shown in multiple studies that actually losing the weight, the pump doesn't have as much resistance to pump against, so the pump goes back to a normal state.
That makes a lot of sense. So we were talking earlier, and of course diet and exercise, as much as you diet and exercise, for a lot of people, it's not enough to lose weight or to keep it off. They need medical help in order to do that.
Correct, and so that's where a lot of people that come to us, the general public may think that people are coming to us to lose weight, when in reality, most of our patients there to get healthy. They want to get rid of their hypertension. They don't want to take 15 or 20 pills a day. The diabetes scares them. And, you know, just with the heart health, they're short of breath walking upstairs. They can't do the things they want to do.
So you have a lot of knowledge about this particular subject. For people who are watching, what are some of the common risk factors for heart disease aside from obesity?
Okay, so there are some other things. It's not just obesity. Certainly age greater than 65, whether or not you smoke, family history, alcohol or drug abuse. Obviously obesity is one of those. So.
All right, well, it's good to know. It's important stuff for everybody's health. It's not about just looking good. It's about being healthy and staying healthy.
Correct.
Thanks for being here.
Thanks.
You can call 800-727-2197 or simply go to nicholsonclinic.com to learn more about the benefits and life-saving impact of bariatric surgery.